status of dialysis care in India, we are still in the formative stages. 15 years back when we started, it was in a very different condition compared to now. But I think we have long way to go before we can call ourselves as an advanced dialysis care country. When we started 15 years back, dialysis was seen as a death sentence. Literally another 6 months, 1 year to live, do not travel, do not work, do not exercise, nothing. But now I think with NephroPlus having set up in 270 cities in 25 states, we are enabling people on dialysis to lead a normal life. They are now working, they're traveling, they're going around for holiday dialysis destinations. So they're also trying to exercise now. We conduct the world's only dialysis Olympiad, where 800 to 1,000 patients come and participate in track and field events like walking, cycling, running, badminton, and so on. So the perspective has changed quite a bit, but I still think the access to quality dialysis care has to significantly improve, and maybe it will take another 10-15 years for us to get to advanced dialysis care. But it's far better than where we were 10-15 years ago. So recent innovations has been, if you look at standalone dialysis clinics, which are the outpatient dialysis clinics as compared to in-hospital dialysis setup. That's a relatively smaller scale right now, but this innovation is going to expand significantly over the next 10-15 years. The government has started recognizing standalone dialysis clinics. Few state governments like Gujarat and Maharashtra have adopted the standalone model wherein we get reimbursed for the state health schemes. But many of the states are still lagging behind in understanding this standalone concept. The other innovation, new model that has come up with is home dialysis care. So we actually go to a patient's home and we take the equipment, the consumables, the human resources, everything that's needed to deliver dialysis into a patient's home and deliver dialysis. That's been there in the last few years, but it's very expensive because, as you can imagine, a patient coming to a dialysis clinic where there are nurses and therapists taking care of many patients versus we sending our human resources to a home, it's quite expensive. So the scale is low, but we are seeing very renewed interest in people willing to pay for the convenience of getting dialysis at home, and also it's infection-free environment, right? It's their own home. So we see these two things really changing the way dialysis is performed. Coming to partnership with the government, the public-private partnership model is making huge inroads. For example, over the last 10 years, we have partnered with 4 state governments, Andhra Pradesh, Bihar, Uttarakhand, and Karnataka, to work inside government hospitals where we set up our own infrastructure, our own staff, our own equipment, everything. It's a NephroPlus center inside a government hospital. Instead of a private hospital, it's inside a government hospital. The patient gets dialysis for free, but we bill the state government who work with National Health Mission, NHM, and they pay us in a couple of months once we submit our invoices. So this is where the patients are getting access closer to home, but the government is getting better quality and the taxpayer burden is much more efficiently utilized than very inefficient laden government offering its own dialysis services. So I think technology is going to be a key factor in the future of our dialysis care. We are already using a lot of technology in terms of enabling better dialysis care. But I think there is a long way to go where it becomes a truly paperless system. Even today, many of the government authorities, they expect paper work to be done, hard paper sheets to be maintained. Now we are seeing little bit of an adoption with EMRs, with electronic records and so on. Few states are advanced like Andhra Pradesh, many states are lagging behind. Over the next 5 years, I think technology will play a critical role. Ultimately, dialysis needs to be done by the human resources, by the equipment, but the entire paraphernalia around dialysis has to be better driven by efficient use of technology. But we are seriously halfway there. There is a long way to go on adoption of technology. NephroPlus is already present in 4 other countries, Nepal, Philippines, Uzbekistan, and now Saudi Arabia this year. India, I think, has a key role to play in the global healthcare ecosystem. And in dialysis, we are taking the lean operational model that we have built over the last 15 years in India, and we are bringing a lot of efficiencies in the global other countries, international markets. So, for example, in Uzbekistan, when we went with, by partnering with the Ministry of Health, we reduced the cost of dialysis care by 35%. And we improved the clinical outcomes where the government measured pre-NephroPlus and post-NephroPlus, and our mortality rate is significantly better, 35% better than the previous mortality rate. So both on the cost side and the clinical outcome side, we are making a huge impact. And India, I think, has a huge role to play because we are a large country, 1.5 billion people. We have figured out many healthcare services which should actually go and make impact in many other countries. And we are one of the very few or the only healthcare companies which has actually gone overseas and physically providing these services in other countries. And I expect many more healthcare companies to do that. So digital health and remote patient care is already happening. I think the AI is one area where we would need little bit more time. For example, we are using AI from a cost efficiency factor. If you think about it, customer care used to be all driven by people, real people making the phone calls to the customers and so on. But in NephroPlus, the whole customer care function now is managed by AI chatbot called Pooja, who is completely taking care of end-to-end customer care, right from inbound queries to concerns, complaints, any holiday dialysis facilitation. The Pooja AI chatbot is completely driving it, which has completely changed the customer care function, right? We see AI changing many such functions, be it audit function, be it operations monitoring function. Many such functions will be driven by AI, but we are still in the early stages of leveraging AI in this space. So our vision is to enable people on dialysis worldwide to lead long, happy and productive lives. Now every word is carefully chosen there. Long because we want to extend the lives of the people on dialysis. Happy because the quality of life is important. We don't want just people like vegetable to survive, we want people to thrive. So the quality of life, happy life is very, very important. And productive. We do not want people on dialysis to completely stop working and become a burden on the ecosystem. We want them to start contributing to the ecosystem by being productive. So, and worldwide scope, the fact that we are already in 5 countries and will be in another 5 to 10 countries in the next 5 years, we want to take this vision truly from a global vision to make real global impact. One of the major achievements is we got a global patent for our dialyzer reprocessing system, which is a very technologically advanced medical equipment. So we were the only ones from Asia to research in this space and build our own hydraulics, electronics to gather our patent, and now the machine is going to be utilized in NephroPlus ecosystem. Then if you think from a patient enablement perspective, we are the only ones in the world who do dialysis Olympiads, where people come and participate in this track and field activities. So we are completely immersing ourselves to figure out how we can make dialysis care better, both from a support to the patients, both from an enablement of more efficient operations. We are even building our own manufacturing facilities, which are making it much more efficient in terms of creating these consumables for our dialysis facilities. Internal strengths, I think the team, we have built an amazing team of the management team and the functional team. I think at the end of the day, a single person or 2 people can only do so much. I think the human resource power in NephroPlus is immensely powerful. I think the next is the savviness with which we are able to be nimble around business model, savviness to adapt to international geographies. Now we are operating in 4 other countries. How do we integrate our international operations to the corporate headquarters in India? NephroPlus is very, very nimble and advanced in that case. So I think the teamwork, the culture, the DNA that we have to be nimble and adaptable, this is positioning us well for lot more growth in the next 5 to 10 years. So the fact that our co-founder is himself on dialysis for the last 28 years, we take it a little bit personally in terms of being very empathetic to the patients. Now, the whole holiday dialysis is envisioned by the co-founder who is himself on dialysis. No other network in India has this holiday dialysis network. If you want to go to a beach in Goa, backwaters, the hill station in Dehradun, Taj Mahal in Agra, the snowfall in Srinagar, we have facilities in all these places, even pilgrimage centers like Tirupati, Varanasi and Haridwar and so on. So we are really enabling people on dialysis to avail holiday dialysis facilities, and the whole patient centricity is around every dialysis clinic having its own Wi-Fi system so that patients can work while being on dialysis. They can get access to entertainment through their phones or the televisions that we provide. The dietitian support, we have a headquarters in Hyderabad where the nutrition dietitian team sits, and we are utilizing technology to do video conference call with all our clinics across the country, because practically you cannot have a dietitian in every dialysis clinic. You need to utilize technology to utilize that central team to provide remote services to all your nodes across the country. So we are doing the best we can on the dietitian support as well. We will continue to expand our international partnerships across many other countries in Southeast Asia, Asia, Middle East, CIS and so on. And I think the team has to be capable and willing to adapt to different international conditions. And the team is working on various entry model strategies, be it through acquisitions, be it through partnerships with the governments in various markets. That will be our core future strategy for expansion. I think from a collaboration, we are partnering with these 4 state governments to also push for preventive healthcare coming into the government programs. For example, the non-communicable diseases program does not have today a chronic kidney disease program. So we are working with the governments, these 4 state governments and the central government, to bring kidney disease as a core non-communicable disease program. We are also working with George Institute of Public Health to figure out how to improve our clinical protocols, how to improve our clinical outcomes using their global public health expertise. So these partnerships are continuous and emerging, and we are continuously trying to improve the care. I mean, to be brutally honest, all the management teammates' numbers, mobile numbers, are provided in each of our dialysis centers, in addition to the escalation metrics of the center manager, cluster managers, zonal managers. So I think patient feedback is critical, the customer is the king, and we take each and every feedback very seriously, and there is a ticket that gets created whenever a patient complaint comes in. And I still personally get emails from the patients, WhatsApp messages from the patients, because my mobile number is listed. So we take the patient feedback extremely seriously. Of course, because we have such a distributed setup, there will always be few issues that come in. I think the key is how do you respond to those issues, operational issues, and the team is aware that the issues can get escalated to the highest levels in the company. So that puts a very good pressure to make sure customer feedback is taken quite seriously.